Well, I think the changes in sex and gender issues has actually been more of a process than one single change. And it started with the previous iteration of DSM, where we added a section specifically about sex and gender and whatever information was available. During this most previous iteration, what we've done is we've split off sex and gender. And you may wonder what I'm talking about. Well, gender is actually a psychosocial construct, whereas sex, that is the sex someone is assigned at birth, is something we consider more of a biological construct. Often it's determined by someone's genes or their biology, although not always genes and biology. But we tried to differentiate those two components when we talk about sex and gender. And we looked at the literature, and when there were relevant findings relating to diagnosis or clinical course or epidemiology, we included that in DSM. So that is the major change that we have included during this last iteration of DSM with regard to sex and gender. Well, what it means really is the book is relevant to as many groups as possible. And whether we're talking about the diagnosis or we're talking about course of illness or we're talking about treatment, we're including the information that may show some differences or may not show differences. And it really can help guide clinicians when they're taking care of patients and make the information that is in the manual as relevant to that care as possible.